From Studio 550, this is the McGraw Show on KTRS.
Well, we're still in the middle of flu season, and an FDA warning came out. To talk about it is Dr. Michael Lim, Chief of Cardiology at St. Louis University Hospital, here in studio. Doctor, thanks for joining us.
Happy to be here. Thanks.
Tell us about this FDA warning on Z-Paks.
Well, you know, from a doctor's standpoint, I don't think this was that big of a piece of news, but what it really states is that every drug has a potential side effect, and this one has a potential to increase slightly the risk of heart rhythm problems. And the FDA has a job to make sure that doctors are aware of all of the potential side effects of drugs, and that's what the warning was about.
Z-Paks are prescribed because of why?
So Z-Paks are antibiotics. It's
okay.
The name of the drug is azithromycin. It's a good antibiotic. It's used very frequently for a lot of different things, most of the time for pneumonias, used very heavily through the cold and flu.
Penicillin, it's because it gives, and I think I've been prescribed a Z-Pak. It's a combination of pills, is it not?
Well, it's different from penicillin in that it acts differently. So all antibiotics sort of target different bacteria, and it's different than a lot of other antibiotics in that it's actually taken up in some of the immune cells in your body, and it stays in them for a while. And so it's a short course of antibiotics. You only have to take it for a handful of days. You take 2 pills the first day, and then you take 1 pill for 4 more days. So it's a really short course rather than the 10 days or 2 weeks. But it seems to be effective for 10 days to 2 weeks.
Gotcha. And the FDA ruling says what? That there's a slight problem?
The FDA ruling says that doctors should be aware that this drug has potential for causing an electrical problem within the heart. It's basically a short circuit. It's not a definite problem. There's many people who have taken a Z-Pak and not had this problem. So, you know, the issue is it's not one-to-one, but it increases your risk for lengthening an electrical signal time from point A to point B. And if you take other medicines, or you have a genetic predisposition to have already a longer time between those 2 points, then we need to worry.
You're a patient, or you're somebody who would be prescribed a Z-Pak, and you're listening to this. Should we know anything when we go into the doctor? Should we be alert to something? Should we watch out for something if we're going to take a Z-Pak?
So I think I would make a more general recommendation, and that is every time that you go into the doctor's office and you get prescribed a drug, and in this case we're talking about a Z-Pak, you want to know about, okay, so what does this do? So how is this going to work? And then you want to know, okay, well, what are the side effects? And in this case, you say, well, I heard on the news, I heard on the radio that this causes heart problems. So am I on any other drugs that this is going to interact with to increase my risk for the heart problem too much? Should I not take this? Is there a different choice? What are my other choices? It turns out that many other antibiotics also cause the same problem. So this isn't uncommon in doctor world.
Is this drug, is the Z-Pak overprescribed like many drugs are overprescribed?
Well, if we're talking about the overprescription of antibiotics, that's probably yes. There's probably many people who have viral infections that get prescribed antibiotics, and antibiotics aren't going to be very effective for them. However, I don't think that we've seen too many of the people who end up on the downside of this equation. That was where the FDA came from and said, you know, just be careful.
I grew up with a family of 6 kids, and I took medicine that was prescribed to my sister, and my sisters took medicine that was prescribed to me, and it was saved in the medicine cabinet for the next time somebody gets sick. While we survived, and many people did it, that's not a good practice.
That's not a good practice at all. But and I think one of the things that doctors like about the Z-Pak is that it's basically impossible to do that because of the way that it's dispensed. So it's 6 total pills. You take 2 the first day and 4 the next one. There isn't any left over. By the time you're feeling better, all of those are gone, and so there's no stored pills of this type of medicine in medicine cabinets, I bet.
You mentioned drugs are overprescribed, and that a lot of people think they should take antibiotics for all things. you shouldn't take it, you mentioned, for viral infections. Explain that difference, because that's important.
Well, so viral infection, which is more or less what we get kind of when the cold and flu season comes around, is caused by a virus. It's a different type of infection. It's not caused by a bacteria. Antibiotics are specific drugs that actually help the body get rid of bacteria. They have no effect on viruses. And so this is the common thing. Now, different people are wanting them in different ways. And so some people are pretty tough. They go on for 10 days or 2 weeks. The most recent bout of the cold's been pretty challenging. And so I've been doing this for 2 weeks. I think I need something. And that's sometimes where antibiotics were used.
How much are you worried about this super bug that's out there that people keep talking about?
Well, these are significant concerns, because the real issue from a public health standpoint is not just antibiotics, but drugs in general. The development of new drugs, the development of a new antibiotic. We haven't seen one in a long time, and so. We're not necessarily doing a very good job from a healthcare standpoint of staying ahead, and that poses significant risk to potential superbugs and other things down the road.
That is Dr. Michael Lim. Doctor, thanks for coming in today. Appreciate it.
My pleasure.
He's Chief of Cardiology at St. Louis University Hospital. Dr. Michael Kim here on Big 550 KTRS. Tim Weiland, take it away. You're in the KTRS Traffic Center, sponsored by Sonic.
We've got another big problem. It's on eastbound 44, just east of Grand. You've got